testing for COVID-19 largely done at home now, which means results are not necessarily getting reported to the state for monitoring.
Different system that doesn't rely on test results is Wisconsin's wastewater monitoring program, now being recognized by the CDC. In a First Alert update, Brittany Schmidt explains.
Monitoring wastewater for disease is not a new concept. It's been used to monitor polio and other viruses. But UW-Milwaukee professor Sandra McLellan says the pandemic spurred a lot of inventiveness and discovery in this field.
I think the pandemic drove a lot of innovation that really allowed us to set up the system. And now we're thinking about doing things that maybe we weren't prompted to do previously. Before the pandemic.
When the COVID-19 pandemic emerged in February of 2020, McLellan says their lab at UW-Milwaukee started right away trying to figure out how to recover a virus.
We know how to filter wastewater and get all the bacteria out. That's super simple because they're kind of big. They stick on filters. Viruses are tiny. They're much more sparse. So we had to try a lot of methods.
New Water, the brand of the Green Bay Metropolitan Sewerage District, recognized the importance of this effort and started preserving samples early on.
We would freeze them, and then once they were ready for them, then they started testing.
New Water continues to send samples for testing every week. The results are entered into state and national databases for monitoring. It's a tool that put wastewater management in a whole new role in public safety.
Wastewater is, out there helping protect the public health and, being an indicator for early warning signs. It's that's the heart of our mission, is to really protect public health.
It's that collaboration and common goal, McLellan says, is the reason Wisconsin's Wastewater Surveillance Program has been named a National Center of Excellence by the CDC.
Now we have 3.5 years of experience, and I think that that's really useful for people who are just either starting or are thinking about doing new things, that we can share that information about what worked for us and what didn't work for us.
She is also looking to the future, where this type of monitoring could also be used to track another growing concern, antibiotic resistance. I'm Brittany Schmidt for Action 2 News.